If you are over 70, there is a quiet moment that comes more often than people admit. It usually happens late at night or early in the morning when the house is still. You start thinking about your body, your health, and the future. You remember doctor's visits, test results, waiting rooms, and that familiar feeling of tension while someone in a white coat looks at a chart. And somewhere in your mind, a simple question forms. Am I really being helped, or am I just being tested? Welcome to the Healthy Senior Lab. I am truly glad you are here today. This is a place where we talk honestly about aging, health, and the decisions that matter most after 70. Not with fear, not with hype, just clear, thoughtful information, shared calmly and respectfully, the way it should be. Everything we discuss here connects to real life, real bodies, and real choices that affect how you feel every single day. Tonight, we are talking about something that surprises many people. 5 health checkups that you may want to avoid after 70 because in certain situations they can do more harm than good. This is not ignoring your health. It is about understanding it better. It is about knowing when a test truly helps and when it quietly creates stress, risk, and unnecessary treatment. Before we go any further, let me say this clearly. Doctors save lives. Medical science is powerful. Checkups matter. But medicine is not one size fits all. What helps at 50 does not always help at 75, and what once prevented disease can sometimes lead to harm later in life. As we age, our bodies change, our priorities change, our tolerance for procedures changes, and the balance between benefit and risk shifts in ways that are not always explained during a short appointment. This conversation matters because too many older adults go through tests they never needed, worry over results that never affected their quality of life, and undergo treatments that left them weaker instead of stronger. So let's slow down together. Let's look at the evidence, the lived experience, and the reality of aging with clarity and respect. Imagine this scenario. You feel fine. No pain, no symptoms. You go in for a routine checkup because it is time. A test is ordered. Something small shows up. Not dangerous, not urgent, but now it needs monitoring. Then another test, then a specialist, then a procedure. Before you know it, you are on a path you never chose, dealing with stress, side effects, and fear, even though nothing was ever bothering you in the first place. This is not rare. This happens every day. The first health checkup many experts now urge caution with after 70 is routine cancer screening that does not consider life expectancy or overall health. For decades, we were told that more screening is always better. Mammograms, prostate tests, colon screenings, full body scans. And for younger adults, these tests can absolutely save lives. But after 70, especially after 75, the story becomes more complicated. Many cancers grow very slowly, so slowly that they will never cause symptoms, pain, or death during a person's natural lifespan. But once they are found, they often lead to biopsies, surgeries, radiation, or medications that can significantly reduce quality of life. Take prostate cancer as an example. In older men, it is extremely common to find slow-growing prostate changes that would never become dangerous. Yet treatment can lead to incontinence, sexual dysfunction, infections, and long recovery periods. The same applies to certain breast cancers in older women. Some tumors grow so slowly that treating them aggressively causes more harm than living with them. This does not mean ignoring symptoms. If something feels wrong, it should always be checked. But routine screening without considering age, strength, and personal values can open doors that do not need to be opened. The second health checkup to approach with caution is aggressive cardiac stress testing when there are no symptoms. Heart health is important, no question, but not every older adult needs advanced cardiac testing just because of age. Stress tests, nuclear scans, and imaging can uncover minor irregularities that sound alarming but never lead to real problems. Once those findings are on record, they often trigger more invasive procedures, angiograms, stents, medications with serious side effects. And in people over 70, these interventions carry higher risks, including bleeding, kidney damage, and long recovery times. If you're walking, breathing comfortably, and living without chest pain or shortness of breath, many cardiologists now recommend focusing on lifestyle, blood pressure control, and symptom-based care rather than aggressive testing. The third health checkup that deserves a thoughtful pause is bone density testing, followed immediately by medication without a full discussion. Bone health matters deeply as we age. Falls can be life-changing, but not every decrease in bone density requires powerful drugs. Some osteoporosis medications can increase the risk of jaw problems, unusual fractures, and digestive issues, especially after long-term use. In some older adults, gentle strength training, balance exercises, vitamin D optimization, and fall prevention strategies may provide more benefit with fewer risks. Testing is not the problem. Automatic treatment without context is. The fourth area is routine diabetes screening that leads to overly aggressive blood sugar control. High blood sugar can cause damage over time, but in older adults, very tight control increases the risk of dangerous low blood sugar episodes. These episodes can cause dizziness, falls, confusion, and even loss of consciousness. Many seniors end up feeling weak, shaky, or anxious because their medication targets were set for someone decades younger. Current thinking emphasizes comfort, stability, and safety over perfect numbers. The fifth and final health checkup we'll explore tonight is routine imaging for aches and pains without red flags. Back pain, knee pain, shoulder stiffness, these are common parts of aging, but scans often reveal abnormalities that sound frightening but are actually normal age-related changes. Once those images exist, they can lead to unnecessary surgeries, injections, or long-term pain medications. Often simple movement, physical therapy, and time provide better outcomes with far fewer risks. At this point, you may be thinking, so what should I do instead? That's exactly where this conversation is going next, because avoiding harm does not mean avoiding care. It means choosing care that aligns with your life, your body, and your goals. In the next part, we'll talk about how to have better conversations with your doctor, what questions to ask before agreeing to a test, how to weigh benefit versus risk after 70, and how to protect your quality of life without living in fear. Before we go any further, take a slow breath with me. This next part is not about resisting doctors or pushing back against care. It is about reclaiming your role in the conversation. Because after 70, the most powerful tool you have is not another test, it is informed judgment. Many older adults were raised in a time when you did not question medical authority. The doctor spoke, and you nodded. That habit runs deep, but modern medicine has become incredibly complex, and even the most skilled physicians cannot fully understand your priorities unless you speak them out loud. Here is something few people are ever told. A good doctor does not want blind agreement. A good doctor wants partnership. The first step is learning how to pause the process without shutting it down. When a test is suggested, you do not need to say yes immediately. You can calmly ask, what will this test change? That one question alone can shift the entire conversation. If the answer is unclear, vague, or focused on just to be safe, that is a sign to slow down. Another powerful question is, what happens if we do nothing right now? Sometimes the honest answer is, probably nothing, and that answer matters. You can also ask, what are the risks of this test or treatment at my age? Not the general risks, the age-specific risks. Older bodies heal differently, react differently, recover more slowly. That reality deserves respect. Now let's talk about quality of life, because this is where many health decisions quietly fall apart. At 70 and beyond, the goal is no longer just adding years to life. It is protecting the life in those years. Energy, independence, mental clarity, comfort, confidence in your body. A test that slightly reduces a long-term risk but significantly increases pain, anxiety, or disability may not be a good trade. That does not make you careless, it makes you thoughtful. Think about your own values for a moment. What matters most to you right now? Is it staying independent in your home, being able to walk comfortably, sleeping through the night, traveling, spending clear-headed time with family, avoiding hospitals? There is no right answer, but there is your answer, and medical decisions should follow it. This is especially important when dealing with incidental findings. These are things discovered accidentally during scans or tests done for unrelated reasons. Small nodules, mild irregularities, borderline numbers. Once discovered, they can take on a life of their own. More tests, more appointments, more worry, even when they never cause harm. Many older adults live with incidental findings that never change, never grow, and never affect their health, but the stress they cause can be very real. Stress itself is not harmless. It affects sleep, blood pressure, immune function, mood, and memory. Living under constant medical vigilance can quietly drain joy from daily life. Now let's talk about something deeply personal: fear. Fear drives many unnecessary tests. Fear of missing something, fear of regret, fear of being blamed, fear of aging itself. Doctors feel it, patients feel it, families feel it. But fear is not the same as wisdom. Wisdom looks at probability, not possibility. It considers what is likely, not what is imaginable. It understands that zero risk does not exist, and chasing it often creates more danger. There is also the reality of false positives, tests that suggest a problem when none exists. These are more common as we age because our bodies naturally change. False positives lead to biopsies, surgeries, medications, and emotional distress. Many older adults suffer lasting harm from chasing shadows that never needed attention. This does not mean ignoring warning signs: new pain, unexplained weight loss, persistent fatigue, bleeding, sudden changes. These always deserve evaluation. The difference is intention, symptom-driven care versus routine automatic testing. One is responsive, the other is mechanical. Now let's talk about family pressure, because this comes up more often than people admit. Adult children often push for everything possible. They love you, they are afraid, they want reassurance. Sometimes they want to feel like they didn't miss anything. But your body is not a checklist. It's okay to say, "I appreciate your concern, but this is my decision." It's okay to prioritize comfort over intervention. It's okay to choose peace over procedures. These choices are not about giving up, they're about choosing wisely. Some of the healthiest seniors are not the ones with the most tests. They're the ones with strong routines, meaningful connections, gentle movement, good sleep, nourishing food, and a sense of control over their care. They focus on what they can feel and experience, not just what can be measured. As we move forward, I want you to hear this clearly. You are not being irresponsible by questioning a test. You are being engaged. You are being informed. You are being honest about your stage of life. Medicine should serve you, not the other way around. Before your next appointment even begins, there is quiet preparation you can do that changes everything. This preparation does not take long, and it does not require medical knowledge. It simply requires clarity. The night before an appointment, ask yourself 3 simple questions. How do I feel most days? What worries me the most about my health right now? What do I want to protect above all else? Write those answers down, even if it is just a few words. Energy, independence, less pain, clear thinking, fewer medications. When you walk into the room with those priorities in mind, the conversation naturally becomes more focused and more respectful. Doctors are trained to fix problems, but sometimes the most important thing is not fixing, it is preserving. When the appointment starts, you do not need to challenge authority. You only need to guide the direction. You can say something like, "At this stage of my life, my main goal is staying independent and feeling steady day to day." That single sentence quietly reframes every recommendation that follows. If a test is suggested, slow the moment down. You can ask, what problem are we trying to solve with this? That question is calm, reasonable, and deeply revealing. Sometimes the answer is clear and important. Other times it becomes obvious that the test is being ordered out of habit rather than necessity. You can also ask, how often does this test actually help someone my age? Notice the phrasing, not how often it finds something, how often it helps. Those are not the same thing. Another useful question is, if this test finds something minor, what happens next? Many people agree to a test without realizing it may open the door to a cascade of follow-ups they never wanted. Now let's talk about second opinions, because they are often misunderstood. Seeking a second opinion does not mean distrust, it means perspective. Medicine is complex, and reasonable doctors can disagree, especially when age and quality of life are involved. A second opinion is particularly valuable when a test or treatment carries significant risk, long recovery, or permanent side effects. It is also wise when you feel rushed, unheard, or pressured. A good second opinion should feel calmer, not more alarming. It should acknowledge uncertainty, not inflate it. It should ask about your life, not just your lab results. If you ever feel like a decision is being driven more by protocol than by you, that is a moment worth pausing. Now we need to talk about numbers, because numbers dominate modern medicine. Blood pressure, cholesterol, bone scores, blood sugar, imaging measurements. These numbers matter, but they are not the whole story. Numbers are tools, not goals. Chasing perfect numbers in older adults often leads to overtreatment, more medications, more side effects, more interactions, more falls, more fatigue. Sometimes a slightly higher number with stable energy and clear thinking is healthier than a perfect number with constant weakness and dizziness. This is especially true with medications. Many seniors are taking prescriptions that were started years ago and never reevaluated. What made sense at 60 may not make sense at 78. Medication reviews are one of the most overlooked yet powerful health checkups for older adults. Asking, "Do I still need this?" can prevent more harm than almost any scan. Now let's address a difficult but important truth. There is a point where more medical intervention does not extend meaningful life. It only extends medical life. This is not about giving up. It is about recognizing limits with dignity. Some tests find diseases that would never affect how you feel or function. Treating them may lead to hospital stays, complications, and dependence that did not exist before. Choosing not to pursue certain tests can be an act of self-respect. Aging well is not about avoiding death at all costs. It is about living fully while you are here. There is also something deeply psychological at play. Constant testing can make a person feel fragile, broken, or constantly under threat. This mindset can quietly erode confidence and joy. On the other hand, focusing on strength, capability, and daily well-being fosters resilience. The body responds to how we see it. Many seniors who step back from unnecessary testing report feeling calmer, more in control, and more connected to their bodies. They listen more closely to symptoms that matter and ignore noise that doesn't. Now let's talk about trust. Not blind trust, but earned trust. A healthcare provider who respects your age will not shame you for declining a test. They will explain, listen, and adjust. They will recognize that longevity is not the same as vitality. If you ever feel dismissed because of your age, that is not acceptable. Age deserves more care, not less respect. At the same time, if you ever feel pressured to pursue every possible test just in case, that deserves scrutiny. Balance lives in the middle. As we move towards the end of this part, I want you to sit with one thought. Your health is not defined by how often you are tested. It is defined by how well you live. The strongest decision you can make after 70 is not always to do more. Sometimes it is to choose carefully, thoughtfully, intentionally.